Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, my name is Monica Adams. I am a volunteer with the Disability Advisory Council at Northwest Senior and Disability Services. And today I'm interviewing Courtney Neron, who is the incumbent and Democratic candidate for Oregon House District 26. Courtney, thank you so much for being here with us and sharing your time.
Thanks for having me.
So to get us started, can you tell us a little about the votes and legislation you've supported in the last session that directly benefited seniors and people with disabilities?
Absolutely. In the most recent session, let's see, and I've thought about it in terms of in past sessions, advocacy in the past. Legislatively, my team and I stay aware of programming and share resources such as the Senior Loneliness Line and other important services. One of my first bills to pass in 2020 was the Return to Learn bill. As a teacher, this was really important to me because I believe that we need to make sure that we're addressing traumatic brain injury in innovative ways. And that bill emphasizes best practices in the classroom after a traumatic brain injury. This past session, I organized an advocacy letter and had it signed by key legislators to ensure that our legislature allocates significant funding for a rural healthcare pipeline with education and training at the Southern Oregon Medical Center. And this will not only ultimately pull down federal dollars to build our workforce, but it will serve seniors at the Veterans Home in Roseburg. Locally, I've advocated during session and outside of session for the Wish Camper housing development going in my district in Beaverton, the Beaverton area. And that new affordable housing needed state funding in order to be able to ensure that they are able to build many units, and 80 of those units will be specifically for seniors on fixed income and with universal design. So those apartments will be fully accessible for those with mobility challenges. And, I continue to work on solutions to the impending crisis of the federal contracts that are running out for subsidized housing. The changes in rent for Wood Springs apartment in Tigard, for example, would destabilize over, over 140 seniors would be destabilized, and many, experiencing disability as well. If we had not taken action, their rent would rise and they would not have a place to go. So for now, we have been able to stabilize those residents with some OHCS dollars, and their rent increased suddenly, but they're now subsidized. And we still have lots of work to do to make sure that similar complexes across the state, as those federal 30-year contracts run out, are also stabilized. So we're looking at solutions in the upcoming sessions and have worked on multiple different concepts in recent sessions. In 2021, I voted to support the bill to allow physicians' assistants to dispense prescription drugs to their patients once they're registered through the Oregon Medical Board. And this bill helps seniors, especially those in rural communities, access important, sometimes even life-saving medications. And I also voted to support Senate Bill 844 in the 2021 session, which created the Prescription Drug Affordability Board to review drug prices and affordability. And I'll continue to seek opportunities to serve our most vulnerable Oregonians, our seniors, and Oregonians experiencing disability.
It's awesome to hear about everything you've been working on. Thank you for sharing and for all the work you're doing. Can you tell us a little bit about what you've done to advocate for Oregon Project Independence?
Oregon Project Independence is I believe it's a home care program for people who don't qualify for Medicaid. My understanding is it doesn't get federal matching funds. So the state investments in Medicaid home care go a lot further when they get that federal match. So, I support programs, especially if we can make sure that we're able to get those federal matches and make sure that we can attract and retain trained caregivers. So every session, it's been a fight to keep that money in our budget, and that match potential with the federal Medicaid dollars could help offer really robust programming. And so my understanding is there's a waiver process going on right now, and I really look forward to hearing the results of that conversation. It sounds like there's a challenge with the estate recovery portion of that conversation, so I look forward to hearing how that turns out and whether or not that stays in the program or gets pulled out. And I'll be working with the government affairs liaison for NWSDS to make sure that in the future that we can continue advocating for Oregon Project Independence to continue.
We're definitely paying close attention to that conversation as well. It's great to hear that you're keeping track of it and in touch with us on it. We really appreciate that. Can you tell me a little bit about how you plan to prioritize funding for services to an expanding population of seniors and people with disabilities?
Can you repeat the question?
Can you tell us a little bit about how you would prioritize funding at the state level for services to an expanding population of seniors and people with disabilities?
Yes. Well, I think we need to continue investments is first and foremost, and continue adapting and making sure that we are looking at what issues our seniors and people with disabilities are experiencing. I'm thinking specifically right now about adaptations. As we know, the heat and extreme heat waves are projected to be longer and more frequent. We know that the heat dome killed vulnerable people across the Pacific Northwest and really showed the importance of including air conditioning for vulnerable populations. I want to stop and thank the NWSDS for also supporting some of our Newburgh residents who were needing access to cooling devices just in this past week. And it sounds like your organization is really able to support them and make sure that that distribution of air conditioning units to people in need happened. So it really underscored the importance of this particular organization. And in terms of an expanding population, just again, making sure that we have investments that match the need as much as possible. I am currently working with parents of highest medical needs children in Oregon. Their needs are everything from access to education, closure of care homes, and when we absolutely need those services. And I'm also working with the parent caregivers to when their children receive Medicaid hours, making sure that we can stabilize those families. And I'll be convening a work group in August for that. I'm also interested in removing the cap on special education funding as the leader in the Education Committee in the House, really looking at our youth who experience disability as well, and making sure that our system supports people with disabilities at a very young age and all the way through their lives. Regardless of, their age, we need to make sure we're treating vulnerable people with disabilities with dignity and respect, and make sure everybody knows that they're valued members of our community and should have choice and control about the support that they receive. And I really appreciate hearing from advocates to guide that legislative work. So we look forward again to hearing from stakeholders and individuals experiencing disability and seniors to make sure that we have the best possible outcomes.
That's great to hear. Thank you. We really appreciate it when people are connected with advocacy and the community. So looking at the state level again, and you'd mentioned earlier projects with affordable housing, which is really, really interesting. That's something we're really invested in. What else, I guess, or can you tell me a little more about what we can do on the state level so that seniors and people with disabilities have an increased housing available that is affordable to them, as well as appropriate nutrition, which is also a barrier sometimes?
Absolutely. I really want to promote development of projects like the Wish Camper development in the Beaverton area. I think it's a model for co-locating services. They're going to co-locate a library, co-locate food access, whether it's a grocery or potentially some restaurants, and really talking about what other co-location is needed so that individuals have what they need close by. Transportation options, of course, making sure that we have robust transportation for individuals who need it. So building inventory is one of the things we really have to do, and considering universal design as a standard that will serve our individuals with mobility challenges. We've underbuilt housing, according to economists in Oregon, by 110,000 units, and we need dynamic housing options within that large number. So we really need to make sure that we're creating spaces for people to live. Another thing that I really appreciate is in terms of living situations is having access to intergenerational opportunities as well. And I'm really interested in looking at care opportunities as well as housing opportunities that co-locate a variety of ages. And I've heard about the Wilson House in Salem, so I'll be looking into that model to find out what's working and how the community experiences that. Relative to nutrition, there's a bill that I'm very interested in that would create a restaurant program for seniors to access restaurant meals. And I look forward to bringing back that bill in partnership with some of my colleagues. I believe it was House Bill 4088 in the most recent session, 2022. And there will be a work group, including impacted individuals, and that it would pull down federal dollars, again, that allow elderly and disabled and houseless SNAP recipients and their spouses to use EBT cards to purchase prepared meals from participating restaurants. Additionally, I've just talked to one of my communities that needs a van for hot meals delivery. So there's a variety of things that we need to do to make sure that our seniors are cared for, connected, and fed well.
Absolutely. We definitely agree. So just as a final question, I know we've touched on a lot of topics. A big one, especially because of the pandemic over the past 2 years, is behavioral health. What do you plan to do as a legislator to address behavioral health issues that have been exacerbated by isolation related to the pandemic?
Oh, absolutely. The isolation that our seniors have experienced during the pandemic has been really devastating. And we're seeing challenges in mental health across demographics, but really that layer of fear of the pandemic impacts for our seniors, the vulnerability that we know that this past few years has placed them in. And then that extreme isolation has really been a concern of mine. I want to make sure that we are providing quality home care services and making sure that we are developing a workforce that can really respond to our mental health care needs across the board, making sure that we have culturally responsive, linguistically diverse, and a workforce that understands various challenges of various age groups as well. So recruiting, training, and retaining high quality workers is going to be one of the first steps that we do to improving our mental health response across the board. And so I'm hopeful that we can improve that and also provide increased home care options so that individuals can stay in their communities and emerge with counsel and care.
Absolutely. Thank you. So Courtney, thank you so much overall just for taking the time to answer our questions today. I'm sure you have a lot going on and we really appreciate it. And to everyone watching, thank you for joining us today for this interview with Courtney Neron, who is the Democratic candidate for Oregon House District 26.
Thank you so much. Thank you for having me. And thank you for all that you all do for seniors and Oregonians with disabilities.
Thank you.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.